Thank you so much for joining us today. In our office, we find ourselves taking care of lots of families and children and infants, many of them dealing with some kind of breastfeeding issue or birth trauma or something like that. It's very important in our commitment to help our families grow healthier every day from birth and beyond that we're connected with really good providers that have the ability to move your health in the right direction, that look at your body in a holistic way, that also treat you as a family, not just a symptom. And so today we have Angelica Hibbs from Barrio Babies, and she takes care of babies when they're born. She also can provide some care for moms in that process too. And so I just want to take a moment and introduce Angelica Hibbs. Thank you so much for joining us today.
Thank you, Dr. Tompkins, for inviting me. So, my name is Angelica Hibbs. I'm a family nurse practitioner, a BCLC. So, I also have a certification to help people with lactation. Barrio Babies is the newborn outpatient clinic here in Tucson. And I'm here to just fill in the gaps in care that when parents need a newborn follow up appointment or lactation consult or mom needs care in that fourth trimester postpartum period, you can't get a hold of your OB, you can't get a hold of your pediatrician. I'm here for the community and I'm open Saturday and Sundays. So yeah, I love taking care of mothers and babies. It's truly my passion. I've been doing it since 2004. Yeah.
Oh, you've been around for quite a while. Um,
Yeah.
that's that's really fantastic. And you had mentioned filling in the gaps. And I just want to make sure that I'm not missing anything. What are some of those gaps that families tend to run into that you're able to fill in their care?
That is a great question. I had been working at TMC since 2018 as a family nurse practitioner in the newborn nursery. So just checking all the babies, making sure they have a safe discharge home. And many times I either had to keep a child an extra day to monitor feeds to make sure they were gaining weight properly or for phototherapy or maybe they didn't need phototherapy, but there was going to be nobody to check them on Saturday or Sunday. So after doing that for about 5 years, I'm like, we're a city of over 1 million people and we don't have anybody to care for our infants on Sundays or Saturdays. So I opened up Barrio Babies last January. So we've been open for a year now. And boy, you can just feel that there was a great need for all of these parents or just getting a newborn follow up the next day. So we've been pretty busy and it just feels so good to be able to keep these babies out of the hospital with their parents growing and thriving. Yeah, that's pretty much filling in the gap. Or
Yeah.
if it's a weekend and mom can't get a hold of her OB and they feel like they have mastitis symptoms. So helping with that. I do a lot of that also.
That's really great. So potentially you're not necessarily completely replacing their providers, but you're offering an opportunity to be there at times that their provider generally isn't going to be there.
Absolutely. And I try really hard to keep their provider updated. So to send their OB a message or their pediatrician complete note about the whole assessment. So it's just being part of the team, part of their care, and definitely not replacing. I'm just a resource for the providers, a resource for the parents. So just being an extra set of helping hands.
That's really fantastic. Now you've been taking care of babies and practicing in some way for it sounds right around 20 years. What moved you into this field of health in general? What got you started here?
I have 2 children and my children are all grown up. I have a 21 and an 18-year-old. So I've done it all. We're just about to become empty nesters. But I loved being a mother to my kids. I still love being a mother. I struggled with breastfeeding so much. I was not one of those people I wish I had been, where it was just easy for me. And I just back then there's like breastfeeding outpatient clinics. You can call your pediatrician. People seem to know a little bit more. Back then, there was really nothing in Tucson. So I called the Latch League and try to get as much help as possible, but I just did not have the support. I ended up pumping and I did whatever I could, but I really wanted to be here in this community as a support to women in this just kind of fragile state in those first 2 to 3 months where you just need a little bit more time. So maybe where the appointment is not as rushed. Um, and that's really my passion. I think it's the fact that I wanted help when I was young and it just wasn't there. So that's my passion. I love taking care of women. I've worked as a nurse since 2004. And then I went back and I knew that I really wanted to work with neonates and babies and moms. So I did pulmonology very briefly,
Mm.
but I pretty much have done mothers and babies since my career started.
That's really interesting. I almost take it for granted that, and we've been here for right around, we're about to celebrate our 20th anniversary here in just a few weeks, which is really exciting. And when we began, we were one of the early providers that was working with infants and doing some of the things that we were doing in here. And I almost take it for granted that there wasn't a whole lot of that
Right.
around during the time that we began. Now, in your practice, tell us about some of the services that you provide, some of the things that you offer, the ways that you can help infants and their moms.
So I think something that sets us apart is I am an IBCLC, so we do work with latch, but also once we start to do a deep dive and we find out, okay, it's not just latch. It is an issue with hypolactation. Mom is just not producing enough milk for whatever reason. Then I'm able to run labs on mom and maybe even medicate mom to help her produce more milk. So having that nurse practitioner background helps with that. So I don't have to send mom off somewhere else to get that done. Then we discover, okay, we have a tongue tie. There's an issue with transfer. I'm able to do the frenotomy and release it in the same appointment and then check transfer after. So I think that it is a lot of lactation, but it's a lot of there's other things that we can do. If there's hyperlactation, how do we help mom bring that milk down? How do we help her regulate her supply? If mom is just not feeling good and it's been 6 weeks and she feels like that little anxiety and sadness is still lingering around, I can actually do treatment plus also refer to proper cognitive based therapists. So I think that's something that does set Barrio Babies apart is that we can do just a little bit more for parents when it comes for moms when it comes to lactation. And then the newborn aspect of it is if parents need a newborn follow up on the weekend, I'm able to do those newborn follow ups, a 2 week follow up if needed. I can help with any weight gain issues, things like that. We do in home phototherapy. So, like I said, that was a big reason for me to even start this clinic, was so that these babies could receive treatment at home when they're jaundice. So moms can continue to breastfeed, so they can continue to grow and thrive and not be in a hospital environment. Our hospitals are great here in Tucson, but it's just so much better to be home with your new baby. And boy, that has been just a huge hit with parents. Babies are getting healthier and just staying home. And then they just follow up with their pediatrician.
Very good. Even the best hospitals, a lot of times, you don't necessarily want to be there unless you really have to be there. And
Right.
so, if you can provide those services outside of the hospital setting, that really can be helpful. Now, what exactly, you mentioned phototherapy, and I find this really interesting, but what exactly is phototherapy?
Phototherapy is a way to bring so a test that we check for jaundice is bilirubin. And once those levels get above a certain amount, as the baby ages, the level can be a little bit higher. But if those levels get really high, they can cause issues with learning disabilities later on. So it's definitely something we want to address. And so that's why we do phototherapy. And it's basically just a little blanket with UV light, and baby just stays on the blanket as much as possible, and that helps break up the red blood cells. Babies can poop it out, and it helps lower those bilirubin levels down to protect the baby's brain, pretty much.
That's fantastic. And it's good to know that you can offer that service outside of the hospital. You were talking about issues with breastfeeding and latching concerns. What do you feel in your experience is one of the biggest troubles that a baby has with their latch? What is the typical thing that you see the most?
I will be honest with you. It's something simple. It's not even sometimes it's something simple and that's all moms need to hear, but it's just really a deep latch. It's just latching the baby deeply can fix so many issues. Sometimes it can fix nipple pain, a breastfeeding pain. And when we fix the latch, or you can change positions and everything. And when we've done all of that, if there's still a pain, if mother is still getting, we see the bilateral linear compression wounds at the nipple. And those are usually signs of a tongue tie that has been compressing the nipple and not, there's no proper peristalsis of the tongue. Then we have to address the tongue tie issue. Even after we address the tongue tie issue, sometimes there's tightness of the jaw, there's just tension. And then that's where you come in, where you just, when your babies come back after I've sent them to you, where we might continue to have issues with opening their jaw or muscle tension, these babies come back here like just little noodles.
Oh.
I mean, they're just so relaxed. And the parents are like, oh my gosh, Dr. Tompkins is amazing. And I think something, and I would love to see your work, how you do it, because I think a worry with parents sometimes is that there's going to be cracking. If chiropractor, I get that a lot, or they'll be like, "Oh my gosh," and I say, "It's nothing like that. It's more gentle stretching," and you can let me know what you do with newborns.
And you're exactly right. When one of the first conversation that I have with parents as we're understanding what's going on with baby and the types of things that they're dealing with is just reassurance that this process that we're going to go through is going to be really easy, very simple, and very gentle. There's nothing that's ever hard or abrupt or forceful whenever we're working with babies. If we imagine some of the things that happens with adults when we're giving those adjustments, that's a completely different experience than would happen with the baby. Because if I were to adjust an adult the same way I would adjust a baby, that would be a problem. That'd be problematic. And I'd be afraid to ever have any infant see someone who's going to do that to them. For infants, all you have to do is very easy, very gentle adjustments. And we're usually able to make a lot of change without, definitely without a lot of force or pressure. And so parents are very relieved when they come to see us. Usually the thing that they'll say is, "Oh, that's it? That's all you had to do?" Very gentle pressure for periods of time. And then depending on what else we're dealing with, maybe there are some stretches or some exercises that we need to do. Depending on if we actually had a tongue tie release, there might be certain exercises inside the mouth that we're going to do. One, to help that to heal really well. But then also, there may be some things that we do just to get more mobility throughout the mouth. So we'll teach the parents exercises usually that they can do that will help with that. And sometimes, too, even if we haven't had that kind of procedure done, mobility is key. Like, mobility is really important, making sure that everything is moving the way that it's supposed to. So if someone's considering having that procedure done, then we talk about getting as much mobility as we can. And sometimes after that mobility, we're latching and feeding really well. And if we're not, then there potentially needs to be some more intervention to make sure that happens. So
So
that's,
I
yeah.
Sorry. I also get a lot of when babies are born via vacuum, they don't get that natural movement through the birth canal. They have that tension. And no matter how much you release, they still have the tension of the jaw,
Yeah.
of their neck, or C-section babies or babies that have been in the birth canal for hours and hours before they delivered. Those are the times when I see the most need for your services because I do some very simple body work in the baby that is very reflexive to help them open their mouth.
Mhm.
But these babies definitely need more relief
Well,
from
and the
just
good,
tense and tight.
yeah. Yeah, thank you. And the good news is in babies, things tend to change really pretty quickly.
Mhm.
As an adult, sometimes we're doing corrective work for quite some time, months even. And for infants, usually a lot of those changes, a lot of that tightness and stuff that they've been dealing with, we can usually knock it out fairly quickly within a very few visits over a couple of weeks, potentially at the most, which is really nice that things can change so quickly. Now, you had mentioned that you do tongue tie releases. Do you clip it or do you use the laser or how do you do that?
So I use scissors. We
Hmm.
just clip it. And it's
And that's the
usually
standard, right? That's the standard of care.
I think the standard in Tucson, there are some providers, some dentists in Tucson that do laser.
Mhm.
It's really the preference. And I've done a lot of research into this. I've been doing tongue tie releases for a long time. I think either way is fine to do it. You can
Mhm.
have a laser frenotomy or scissor frenotomy. It's really up to the clinician behind the equipment doing the procedure. How experienced are they? Are they doing a full release? Are they doing a partial release? Um, are they able to deal with reattachment? So I think it's really up to the person doing it. The
Yeah.
way we do it doesn't really matter.
Yeah. That's great. Do you find that you do any work with if there's a lip tie, an upper or lower lip tie, do you find yourself releasing those? Or are you strictly working on the tongue?
I strictly work on the tongue, and studies have shown about lip ties is really, unless baby is blanching at the breast and really no movement, that we should just let it be. But if I do need, I feel that the lip bleeds a little bit more, so I do refer those to ENT for if lip ties need to be done.
Yeah. And that's something that we may tend to notice quite a bit of lip tie, but as long as there's really good mobility, then usually all that tends to work out really well
And
without needing a
and
lot
not
of.
every and not every tongue tie needs a release either. So
Mhm.
I do a full, it's called a Hazel Baker assessment. It's very objective. It's looking at the function of the tie as well as the appearance. So a baby could have a good tongue tie, but with excellent mobility and transferring good amount of milk, not hurting the mother. And there's absolutely no reason to clip that. I'm very cautious, very conservative about the procedure, doing a full assessment and making sure it's actually the right thing for the mother and baby. Yeah. That's why most of our consults are an hour to an hour and a half. We just really do full history and physical, just looking at absolutely everything.
That's really fantastic. We're starting to get low on time, so as we're wrapping it up here, I want to make sure that we have enough time to get this in here, and that is if someone wants to contact you, like when is the most ideal time for someone to start reaching out to you for services for them, and then how would they do that?
Okay, so I think ideal time is if you're pregnant in the third trimester, call us, schedule a prenatal lactation consult. People love these consults. They learn so much. It's a one-on-one consult. So you're not going to be in a group. We're going to do a full history and physical. We're going to pre-game it. We're going to pre-game lactation, make sure that everything goes well for the patient. I think that's a good time, but really anytime if you're in the hospital, you need a newborn follow-up, you're having feelings of mastitis, you can call us at any time. We are so lucky. We take all most major insurances and we are working really hard within the next couple of months. We're going to take also United Access, Arizona Complete Care, and Banner University. Right now, we take American Indian Health Access and all of the other Cigna, Aetna, Blue Cross Blue Shield, United Healthcare, all TRICARE, all the major insurances. Yeah, that's a benefit. You can also use your insurance to come see us.
That's fantastic. You are doing really good work. I talk to lots of people that have gotten care under you, and they have nothing but wonderful things to say. So I'm really glad that we had this opportunity to connect. And I feel like we just got going and now we have to stop. So we're probably going to have to do this again at some point. But I thank you so much for joining me.
Well, thank you, Dr. Tompkins. So nice to meet you.
It's very nice to meet you. And if you guys need anything, if anyone is interested in having Angelica Hibbs to be your birth provider or your provider as baby is born or after baby is born, definitely feel free to contact her. We love her. She's doing really good work. And we really appreciate everything you're doing. So thank you so much for joining us.
Thank you.
All right. Have a great day.
Thanks. Bye.